many of you have ever heard that term mental health before?
At Edmonson Elementary, second graders are learning about brain health as part of the Mental Health Association of Middle Tennessee's Erasing the Stigma program.
So many kids, mental health is a new term for them, so they don't not sure what it is, or they have a negative perception or stereotype. The goal really is to help dispel some of those myths, to break down, here's what is true, here's what's not really true, here's the negative way to view this, and here's a positive way to view this. Here's some of your feelings, and yes, all of them are okay because they're part of you.
Studies indicate that 1 in 5 children and adolescents may have a diagnosable mental disorder. Erasing the Stigma aims to give children the knowledge and tools to recognize certain aspects of mental health.
I especially was interested in this program because I asked my son on the way to school, what do you think mental health is? And he's a second grader, and he said, it means you're crazy. So I said, wow, I think some other kids probably think similar things. So just letting them know that about mental health and that it's okay to seek help.
For middle school and high school, we talk about body image and eating disorders and what that looks like. We also do bullying presentation, ADHD, suicide prevention, and depression and anxiety. So now I want to hear from you. When you're talking to young kids, I avoid using some of these big words they may not understand, but when you break it down to it's your brain and it's keeping it healthy. We start in and we introduce mental health and we talk about one specific aspect. And today we're going to talk about, and somebody said it, who said worry? One of you over here said worry. That's what we're going to talk about today.
I've really noticed lately that a lot of kids have been extremely worried or anxious. It seems to be more than I remember back when I started in my career. Like they can't come to school, they're so worried, or they don't want to do activities because they are so worried.
I hear a lot about grandparents who are getting older and they're worried because they have health problems or just because of their age and they worry about dying. Recently I've heard a lot about the weather, bad storms and tornadoes and floods. I hear about pets, I hear about grades a lot, their tests, report cards. Kids also are worried about moving in middle school and making friends and will they fit in.
I like to do gymnastics, and the first time I went, I was worrying I wouldn't make it. But then I
hope that they're able to normalize that and know that yes, it's okay to feel worried and identify some of the things that maybe you worry about, and then also identify some good suggestions and some real things that you can do to kind of help calm yourself down. Ta-da!
Younger children meet I See Hope. He wears a Band-Aid on his head and a lifesaver around his neck to symbolize important concepts in the program.
It is a symbol to remind you to keep your brain healthy. And the lifesaver reminds you that even though you might worry sometimes, or maybe even you worry a lot, that you are still so special and that you are very important and that your life is valuable. We introduced the deck, and that's sort of a memorable, approachable way to talk about mental health. That sort of is the warm fuzzy, I call it our mascot, to talk about mental health. And so I hope that they remember him and remember what the Band-Aid and the lifesaver stand for and those symbols.
my name is Isaac. My Band-Aid.
I really liked the way that they were communicating in class and letting them know that I'm not the only one who has worries. So I want them leaving feeling like it's okay to worry, but when should I seek help, or what can I do when I worry?
I hope that they're able to know that yes, you can still be a successful, happy human being and still deal with a mental illness. If we can talk about tough stuff like mental health and mental illness and grief, and then they still leave and say that they had a good time, that just makes me feel good and like it is working, and I think it's certainly making a difference.
Major funding for NPT reports Children's Health Crisis has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.